Today we're going to have a presentation done by Linda Sino with Hope Services located in the Santa Clara Valley and surrounding areas. Maybe you can cover a little bit, Linda, the areas that you cover. But what we're covering is supported living services, which is a special program in California that helps assist folks here with their living situations for those that are developmentally disabled. The other part of this for folks that are listening Hope Services is probably going to be working with us on the life passage planning project that we're working on as well. So I know we have a number of folks that are outside of California that have been following this program. And so for those of you that are following that program as well, that once again, part of what we're doing with that program is tapping into services that here of direct provider services that could assist in the management of special needs trusts. That's not going to be today's focus here, but this will give you some idea of the kind of direct service provider agencies that we're looking for, and we'll be expanding that program across the country. Getting back to this program, this is a really important program, and we have many of our beneficiaries of the Golden State Pool Trust, as well as with the law firm, that when these services are tapped into properly, it can really provide some pretty great options for living in the community. So anyway, Linda, I want to thank you so much for joining us today, and I'm really looking forward to learning more about supported living services.
Thanks so much. As Stephen mentioned, I do work for Hope Services. We're a pretty large organization that spans in services from Half Moon Bay all the way down through Santa Clara County, Santa Cruz, Monterey, and San Benito. We're known for providing a whole array of services, from infant programs to senior services and lots of things in between. I'm involved in what we call community living services, which is primarily supported living and independent living skills training. ILS we provide in all of our counties, but at this point we just do supported living throughout Santa Clara and Santa Cruz counties. Before I get started on the nuts and bolts of supported living, I want to share with you some of my experiences before the service was widespread and when I worked at the regional center. At that time, that was probably like 25 years ago, I was pretty involved in working with individuals who lived in group homes and their providers. And while for some it was a really valuable service, there were lots of issues for lots of people that made me start questioning that service. So let me tell you a little bit about some of the issues I dealt with folks in residential care homes and how that led me to really loving the service we call supported living. So I worked with a gentleman, we'll just call him Charles, who was really happy in his home. He lived in the southern part of Watsonville. He liked his room, his roommate. He liked his provider. He had a job. I think he would have told you he had a great life. But unfortunately, the residential care home provider became ill, and Charles had to move. And the regional center at that time could not find him anything local. So I remember Charles had to move clear to the other side of San Jose, where he no longer had his girlfriend, his friends, his job. It was a really, really tough adjustment to him. He was not such a happy fellow, but there were really no other options for him in what was his home community. So another person I think about is a lady called Mary, and she was kind of the opposite. She didn't really like the place where she was living very much. She didn't feel like she ever fit in. She didn't like the activities that the group participated in. She really just wanted to be with her boyfriend and her day service friends on the weekend. I'd get these calls frequently from her saying, "Oh, do I have to go to the mall again tonight? Or I don't want to go see that Disney movie." But you know, unfortunately, because of licensing and staff issues, she had to go with the group. She was not very happy in that situation. And one other thing that really led me to believe in supported living, and this is still an issue, is that this doesn't happen as rarely as you might think. we have people living in residential group homes that have to come to work and to our day programs when they're sick. And, you know, a lot of times they don't feel like coming in because they're sick, or they just don't want to come in, but they have to. And it's not really that the provider is trying to be insensitive, but they don't have staff during the day, and they don't feel like they're able to leave their clients at home. So I don't want you to hear this as my being overcritical or judgmental, although people sometimes think that's what I'm being. But these were my experiences, and they really viewed my shaping and my acceptance of supported living. When supported living came along, again, maybe 25 years ago, it started in California as a pilot project without regulation, and as it spread through the state, I don't know, maybe 2 or 3 years later, we have the regulations that we have now. But, you know, it just made so much sense to me. A lot of things that we all just take for granted became available and really, really improved the quality of life of the people that we serve. And, you know, for families who really hadn't had much say in their son or daughter services, they were able to finally have a lot of input. Like they participate in hiring staff, in terms of accepting the staff, interviewing them, etc. And they can be involved in lots of different ways in their son or daughter's lives. So let's take a look at the first slide. So what is supported living? Well, obviously it's a service, and it's a service that provides individuals an opportunity to make choices about their lives, to determine where, how, with whom they want to live, who they want to work with, or where they want to go during the day, how they want to have fun. And it's with the support of an SLS agency, such as HOPE, but there are many others. And the exciting part about supported living is that it's a service that is not only individualized, but it will be there for as long as the person needs it, with the involvement of those that know and love the person the most. So I really like this next illustration. It's been around for as long as I've been in supported living, and I've been using it and looking at it ever since. And it's kind of different because it describes for you what supported living is not. You know, I think of supported living, and it's really such a simple notion that people get to live in their own homes and make choices. But somehow it gets convoluted a lot of times. I don't know, maybe people think it's too good to be true, or they're concerned about a lot of issues that you know, are symptomatic of other services. I don't know if that's the best way to say it. But so I'm going to give you a minute to look at this, because I'm certainly not going to read them all to you. But then I'm going to pinpoint a few and kind of help you understand what they mean. Also, I'm thinking, Stephen, maybe there's some parts of this, like this illustration, that maybe can go on your website. There'll be a couple other things, too, that might be helpful for people to refer back to later.
That would be terrific.
Okay. So let's take a look at supported living is not another stop on the service continuum. Well, what does that mean? Well, it's actually something really important, because what it means is supported living is not what we call a readiness model. That means that people can come into the service with no special skills. They don't need to be able to do certain things. They don't need to be independent. We serve people who are very capable, all the way to people that need constant supervision and 24-hour support. So with supported living, they don't need any skills when they come into the service, because everything will be individualized based on their needs. Parents a lot of times are very concerned that with supported living, their son or daughter will be lonely and isolated. They come with the belief that they will be much happier with their peers and living with a group of people. And that's probably true for some folks, but what we find is just the opposite, that people really flourish when they're with individuals that they can interact with, that they can get out into the community with. Many of our clients really don't want to spend all of their time with the people in their group homes. And this is not to say anything negative about the people they live with. They just have more opportunities to be part of the community. And if you're with a supported living agency or consider a supported living agency that doesn't know how to get your son or daughter out in the community, I would not go with that organization. That's definitely our goal every single day. This isn't a test to see if you could live with no problems. And if you do have problems, you get sent back to your group living. Hey, we all live with problems, right? And that's true for the folks that we serve as well. So this isn't a test. There's an expectation that just like the rest of us, people are going to have problems. And that's what we work with families, with other staff, with other resources, with the regional center. We try to help people get through those problems. And when a supported living takes on a client, there's a basic commitment that's made to work out any problems that come up, not to just send somebody back to a group living situation. Let me just look at one more of these, and this is an excuse for letting bad things happen to people. Supported living is not an excuse for letting bad things happen to people. The way I look at that is that because choice is such an important part of supported living, some people will look at it and say, oh, gosh, he made a bad choice. Oh, well, that was his choice. Supported living and choice is not an excuse for letting bad things happen. I would be lying to you if I told you we have control over everything our clients do, but we work really hard to help people be healthy and safe. And again, we work with their whole, all the people that are involved in their life to figure out ways to help people make good, healthy choices. So again, I'll make sure that this one goes on the website for you to refer back to. So now supported living is based on very specific principles and values. It's kind of that chicken and the egg thing. I don't really know which came first. I don't know whether the values of supported living shaped the Lanterman Act and the regulations. They say that supported living is the only service where the regulations are based on specific values. But these principles were put into writing by a group called Circle, which is a group of professionals who were kind of the earliest supported living providers. And I guess the best way to describe this is that if the services don't meet these 5 values or principles, then it's not supported living. So let's just take a quick look, and then I'm going to tell you a little story about a gentleman that we serve and how his services relate to these values. So a home of one's own, that's probably one of the most important parts of supported living, that each person we serve lives in their own home, whatever that is. That's not the parent's home or the family home. It's a home where they hold hold the ownership of the home. Their name is on the lease for a house, an apartment, a room, whatever it is, it's in their name where they have control and choice over the home. Supported living is about making choices and self-direction. How does a person want to live in the future? How do they get to just pick even the simplest of day-to-day activities without somebody making a schedule for them or telling them exactly what they need to do each day? Of course, there's planning that goes into that, but nevertheless, the person gets to make choices about where they go during the day, what they wear during the day, who they spend their time with, what they eat for breakfast, whatever those typical kind of decisions that we make each day. Relationships. Relationships is a really important part of supported living, and an agency will work with the individual to help them stay connected to family and friends, and to develop a whole circle of support, those natural resources that we all have that help us plan and live our lives. Community membership is really not so new a term, but it's still kind of a new term that we use when we're really talking about people being connected to a broader community. Again, is there anything wrong with people going to Special Olympics or hanging out with a group of people with disabilities? Obviously, no. And I want to reiterate that. Some people think, oh, in the early days of supported living, we used to say, oh, they shouldn't be involved in any segregated activities. But now we realize that people could also be part of a broader community as well. And then finally, the fifth principle is flexible, tailored services and support, which simply means that a person's services are individualized to specifically meet their preferences and their needs, and our support plans are developed around that. So let me tell you about a guy that we serve. For today, I'll just call him Alex. And Alex is around 30 years old. He's incredibly engaging. He has great receptive language, but no speech. He uses lots of gestures and expressions, and we almost always know what he wants and he doesn't want. But when we're not sure, and I can't ever tell you I'm sure what he's thinking, we include his family and the people that really know and care about him to figure things out. He has an amazing family who we work with, who provides some of the training for our staff. And we've known Alex and his family for a very long time. He's had lots of great experiences, such as he's traveled to Europe with his family. He sometimes goes wine tasting with him. And he lives in a really small town where people know him really well. Alex also has 24-hour support. So before SLS, Alex lived with his family in a beautiful home. And there's a woman, Martha, and her 2 children, who originally came about 10 years ago just to rent a room with Alex and his family. But she has stayed on, and she is there now as his overnight staff. We call them a roommate. And Alex just adores his 2 kids, and the feelings are mutual. Alex's parents thought for a really long time about what might be the best situation for their son to where he would live when he became an adult. We had many, many conversations about it. They didn't really consider a residential care home, but they thought about lots of different alternatives. You know, they thought about moving to a town where there were more apartments, or moving Alex to a town where there were more apartments. They just kind of played around with all kinds of ideas until they decided to take advantage of building codes in their community where they could build onto their home, but build in such a way that there were 2 completely separate residential settings. The surprising thing is Alex's parents decided to move into the little home, and he got the big house to share with Martha and her children, and so that there would be space when his companions and other staff came in. I don't know if any of you have ever watched Tiny House Nation, but that's what Alex's parents' house looks like. It's just this great little compact home where they live separate from him, but where they can have regular contact. Alex has a rental agreement, so that is officially his home, and he makes a lot of choices. What he watches on TV, and if he wants anyone to join him, a lot of times he just wants the room to himself and doesn't want to be bugged by us. He may or may not want to go out in the evening, even though he really likes to walk and ride his trike. He decides when to go to bed, and he decides if he wants to take an extra shower in the day. Those are like such simple things, right? But not necessarily available to people in settings outside of supported living. So Alex is a guy who thrives on routine. But you know what? The day may come when his support needs could change. As he gets older, he has some health problems. If those become more significant, will he need more staff, less staff? We don't know, but we can be there for him in supported living and change our services as his needs and preferences change. Alex also has very, very rich relationships at home and in the community. While his life is separate from his parents, to a certain extent, he's also very close with them. They're definitely more than on the sidelines for making decisions about his finances, his personal care, and his mom is very particular about how we tend to his personal care, but in a very positive way. Alex's program, his day program, is totally community-based, so we can coordinate with that program. It's also Hope Service. So we can coordinate to make sure that he really fully participates in the community. Alex, as I said before, it's a small town where everybody knows him and recognizes him. And when you're his staff, you kind of feel like chopped liver because I don't ever even get a nod. People are so involved in saying hello to Alex. He also has weekend staff who he hangs out with, goes to the city, well, San Francisco, or other things like he really likes to go to the Y. He rides the bike there, and he really likes watching the women in their bathing suits swim. He's very close to his brothers, and he has a new baby nephew that he gets to interact with, and he's close to Martha, his roommate, and her children. When he's in the mood, he'll shop for his food for dinner, and with our help, he pays for all of his groceries. He does paid work at a local farm, and he volunteers for beach cleanup. Alex's services are totally based on his needs and preferences. His schedule is tailored to his needs and lifestyle. When he's sick, he stays home. Sometimes if he has a toileting accident out in the community, he's able to just go home and take a shower and change his clothes. So let's look back now, look at the next slide. I hope that kind of describes for you how his services are really based on these 5 principles. So how do you get supported living for yourself or your son or daughter? It's, I think, a very simple criteria. Because the person is going to receive services from a regional center, a developmental disability diagnosis is a must. For supported living, an individual needs to be age 18 and over. They typically need to be able to sign a lease, or if they have a conservator, the conservator needs to be willing to sign a lease. As far as regional center funding goes, they simply need to have a desire to live in a supported living situation. As I talked about before, there's no readiness test. So if that's the service that you're interested in, at the next program planning meeting, your IPP, you just make sure that there's a simple goal like, I want to live in my own home. And then the process starts to move forward. We do have service coordinators from time to time tell an individual, well, you're not ready. And then someone needs to advocate for that person and show them what the regulations are. These next 2 are not really part of the Lanterman Act, but they're things that really are kind of a requirement if an individual is going to be in supported living. So we already talked about the person has to have access to their own home, and we have to have that in our plan before anything moves forward with supported living. But also, a person has to have the ability to pay their expenses. So the only thing the regional center can fund are all of those services that focus on the person's disability. So supervision, support, emergency response, staffing, that the regional center can fund. But all those other expenses of living like you and I have, rent, PG&E, food, clothing, those are all the responsibility of the individual. Sometimes families are able to help with some of those expenses, and that's something that if there are parents out there listening to this, that's something that you need to consider in relationship to a person's Social Security, whether that's going to impact their Social Security at all. So what's so great about supported living? Well, obviously this is all my bias, and I've already talked about some of this, but I think it's really great the services are individualized. We don't have a menu of services that somebody can pick 1 out of 3 services or however that works. It is based on our getting to know a person, and we'll talk a little bit in a minute about person-centered planning, but developing a plan that's based on how the person wants their life to be, and then the fact that services are long-term and ongoing and can change as the person's needs or preferences change. That to me is a really great thing about supported living. The other thing is that the individual or their family help them choose staff. I don't think that really happens in any other service that HOPE provides, and I can't think of any other service at all, where the person is involved in interviewing and choosing their staff, or letting us know when they don't want that staff any longer. So as an organization, we advertise, we do a screening, we interview, and if we think the person that we're interviewing is a good match for the individual, then we introduce them. Sometimes we can arrange some time for the person to spend with that individual, but definitely the family can come in, do an interview, and they always have the last say. Another great thing about supported living is that we can provide 24-hour services if the individual needs that. So some of that is sleep time. A person typically has a companion for their day and evening hours, and a roommate or staff that come in and out and provide overnight care while the person is sleeping. We also have an emergency response system where any of our staff or any of our clients can call a dedicated line and get a staff, if not immediately, within 15 or 20 minutes. And one of the things that's kind of funny to me is that we have to teach our clients, and sometimes our staff, what an emergency is. Because I remember in the early days, I'd get calls like, what station is Friends on? I think I've missed it. So we have to teach people what an emergency is. But we do have that response system, and it can consist of going to a person's home, or a staff for some reason is late. We can send someone over right away, whatever the situation is that arises. Supported living focuses on health and safety, but what's really important is quality of life. So there's always a balance. We focus on quality of life by providing the kinds of, providing to the kinds of needs a person has, as well as what their preference is, always bearing in mind that you don't have a whole lot of quality of life if you're not living in a healthy and safe situation. We often see people increasing their independence. I would say that's not really a goal in general with supported living. We don't necessarily, it doesn't necessarily have to be that someone will develop new skills and expertise. If somebody is capable and wants to learn, for example, how to cook or how to take public transportation, we're totally available to do that. And that's a very common service. But sometimes a person is not capable of learning those things, or just simply doesn't want to do it. And then we can provide support. But I noticed that independence seems to increase just as the person gets more out in the world, and is a really common outcome. I'll meet someone when they first come into supported living, and then in the years after, and they just become more independent, well-rounded people. The other thing I think is great about supported living is, and then again, I know I've mentioned this before, but it's very important that services can change as individuals change, and that support can be for as long as services are necessary. What sometimes happens is in other settings is a person will age out of the service at 60. That's, for some people, not a good age to make major transitions in their life. Or they'll maybe develop some health care problems. And if they were in a typical setting, that might require, through licensing or whatever, the need to move to a whole new setting. With supported living, we can simply go in with family support, with the individual support, regional center funding, and adapt the services accordingly. So you know what? I'd be lying to you if I didn't tell you that as simple as supported living is, it can also be challenging. It's a great service, but it can be really hard too, trying to exactly meeting someone's needs. I think the frustrating thing, both for our clients and for their families, is that it's a process that simply takes a lot of planning and takes a lot of time. It takes time for us to get to know the individual. We do that, again, I'll talk about it in a minute, through a process called person-centered planning. But we need to take the time to really get to know the individual, what their needs and preferences are. And it takes a really long time. If they come to us without housing or without immediate resources for housing, it can take, even with low-income housing organizations, it could easily take a year or longer to find a place for the individual to live. Maybe once or twice, but I would say rarely will we ever serve someone in supported living situation who's in an emergency situation. When we've tried that, it just, from my perspective, hasn't worked really well. What I recommend to individuals looking for the service or families is, if supported living is even a thought for you, start the planning early. You know, start getting folks on the waiting list. In Santa Clara County, it's called Housing Choices, also for Santa Cruz. But if you're calling into this from another community, find out who does the low-income housing, or go to Housing Authority. Get people on those wait lists. That is an extremely it takes a long, long time, and it's best to be thinking about that early. The other thing is staffing. Staffing can be challenging. I would say the staff that work with me, I don't really know how they do it, but they do an amazing job with matching staff to people's needs and interests, of getting staff who are respectful and honest and really want to be there with the person, and just keeping somebody consistently staffed. That can be a challenge. I think that we're very fortunate at Hope because we're able to offer a little bit higher hourly wage by maybe $4 or $5 more than some organizations, and that does attract staff, but it's a challenge. The other is funding overtime income for our staff. About a year or so ago, the federal government passed a law that staff who work more than 40 hours a week must be paid overtime. There's a little exception in there that if a staff meets a certain criteria and they are overnight staff who sleep for at least 5 or 6 hours consistently, we pay them for their overnight, but it doesn't need to go towards overtime. But you know, those are all the picky little things. The important thing is that we need to pay overtime, but we don't get funded anything additionally from the regional center to cover our costs for that. And so it's not that we don't provide overtime to staff when necessary, but we have to be really careful, and that just makes staffing a little bit more complicated. We're starting to look at planning alternative housing options. So I told you in Santa Clara County, it's really difficult finding affordable housing. I read something recently in one of the papers that Santa Clara Valley is the highest rent in the entire nation. People disagree with that. It doesn't really matter if we're 1 or 5. It's very, very expensive. I'm trying to encourage the people we serve and our staff to look at some alternatives. And I think what led me the way of thinking that is I was interviewing 2 young women who go to San Jose State. And when I discovered that they can't live in San Jose without 3 or 4 roommates and sharing bedrooms, I started to think, well, the folks we work with are pretty poor for the most part. How can they afford housing? And I'm not suggesting that people have roommates in their bedrooms, but we do have to start thinking, is there a possibility that people could rent a room instead of a whole apartment? I'm not sure, but I know that we need to look at other housing options. Maybe other ways like Alex lives, where families have the option of providing housing on their property. That's definitely going to be the future, because many of the people we're serving now are 1 or 2 rent hikes away from losing their apartments. I didn't mean to make this last option sound or look so big. I don't know if that says something, but one of the challenges is really dealing with conflict, not necessarily between the family and the individual or the family and our organization. It's more just in terms of what a family might want for their son or daughter versus what they want for themselves. And we have issues around clients that are sexually active or want to smoke cigarettes or drink or don't necessarily eat the healthiest diet. I mean, as an agency and a supported living agency, we do the best we can, but we don't have control over all of those. And when we're looking at people having typical lives, those are kind of all features of how we all live. And so helping families accept when their sons or daughters want something differently, and also for our clients engaging in a conversation with their family, that is just, that is just a challenge in the service that we provide. So I don't know that you can see this. It's hard for me to know what you're seeing on the PowerPoint. I realize the print is really tiny on this page. But what I want to stress to you is that as a client or as a parent or whoever helping an individual find a supported living provider, I want you to know that once supported living is on the individual's IPP, they can, upon request, be given a list of all the providers in the area who have openings, and you or the person that's going to receive the services have the option of calling and really doing some comparative shopping and finding the agency that they think will best serve them. I'll get this, make sure this is also on, excuse me, Stephen's website, but you can take some time to take a look at this. I have a couple pages of questions, but we generally give this out to families, or we ask the regional center to give this out to individuals and their families, just to give you kind of an idea of the kinds of questions, and to invite you to be very particular and ask these questions. I think providers are expecting it, and if they're not, you might want to think of a different agency. So I'll give you a couple seconds to look at those, and then I'll share with you the ones I think are most important. I don't want to rush you through this, but I'll show you the second page too. And again, we'll get this on the website. So here are some of the questions that I think are most important. And when a family or an individual doesn't ask these, we kind of voluntarily provide this information in our initial meetings with each other. So you want to know, how long has a provider been doing this service? Because it does take a certain amount of practice. And I think of things that we did in the early days that we do way better now. You might want to know, who does the agency feel like they best serve? Do they have expertise with people with serious behavior challenges or folks with medical needs? You know, who are they most comfortable serving, and who do they think they are most successful serving? Have them describe a couple of living arrangements for you. How do they find their staff, and what would your involvement be with that? How do you determine how much and what types of support a person will provide, and how do you go about adapting those services as a person's life changes over time? And do you ever demit people? Are there folks that you simply have decided you can no longer serve? Why, and how do you go about doing that? So these are just some examples of what an interview might be of a supported living provider. A lot of times people don't realize that that's their choice, that they have the right to interview and select staff. The regional center really shouldn't be just assigning you to a supported living agency. I think they do that meaning to be helpful, but I don't know. I don't necessarily agree with that. So I've talked a couple times about person-centered planning, and I guess you could look at person-centered planning as a way of assessing what a person needs and what they want. I think of it as kind of a structured process for listening to how people want their lives to be, or how families want their son or daughter's life to be. And we spend a fairly significant amount of time, first of all, looking at what are the skills and capabilities of a person we might support. Because supported living is a little different than other services. It focuses on building upon people's preferences and strengths. It doesn't have to do necessarily with just looking at what a person's deficits are and how to go about changing those deficits. So in the case of this gentleman, we've called him Bobby for these purposes. You can see, I'm not going to read it all to you, but we also reached out to the people. We use the term know and care most about the individual, and from our time with the person, and we noted that Bobby's a handsome guy. He's smart, he's loving, he's very organized, he's a great listener, he has a beautiful smile, and it goes on from there. We also, as you can see, we would attach a photograph to the person. It's also important what makes Bobby happy. And by happy, we mean what are the things he most wants in his life. What we look at is what we call non-negotiables. What are the things that Bobby absolutely will not live without? Either the things he likes, like I will tell you, almost everybody says a cell phone or a TV. But it could also be things like he absolutely can't live healthy without certain medications or without adaptive equipment, or people that just understand some of the nonverbal language an individual might have. Now, I guess that actually goes more in the next part about how they want to be supported, but that is partly what we look at. So what are those maybe idiosyncrasies, you could say, or what are the needs that absolutely must be supported by a supported living agency? There's lots and lots of other information, but we try to include this in what's called a one-page profile. And we're not 100% there yet at Hope, but we're working really hard throughout our organization to have one-page profiles for all the people we provide services to. You know, we put them up in the person's home. Sometimes we let clients decorate them if they want. It's really their story. And I think it's very helpful as a quick way of kind of getting to know someone, especially as new staff come into the home. It can remind them. I've also seen families that do a one-page profile for their son or daughter's healthcare needs that they can provide to a doctor, or people will do them around their son or daughter's educational needs, or if they're going into a new service. When my mom was really sick and wasn't able to communicate, our family put one of these together for her and gave it to the nurses. And they seem to be, they seem to really appreciate kind of knowing some specifics about her. So that kind of completes my discussion at this point of supported living. I look forward to your questions and your input, but I want to just kind of briefly tell you about independent living skills training. Sometimes ILS is confused with supported living, but they're really very different services, both in their provision and what the outcomes are. So supported living, according to regulations, is considered to be an intermittent training, meaning the person will be provided assistance on possibly a once-a-week basis, once-a-month basis, whatever is decided in the person's plan and assessment. So it's not, there's no potential for 24-hour assistance with ILS. And it's more about helping people learn new skills than supporting a person, although many times there's a lot of crossover there. ILS is time limited according to regulations, but regional centers have learned that there's some areas that people, regardless of how capable they are, will need help on an ongoing basis, like helping planning their time or money management or medical appointments, those kinds of things. But ILS can be time limited. The regs used to say 2 years. I'll be honest with you, I'm not sure if that's still in the regulations or not. And we provide ILS, and I think most agencies do, on a one-to-one basis. Some organizations will serve people in small groups. while we could do that, to be quite honest with you, the funding is pretty bad when it gets to 1 to 2, 1 to 3, and it's hard for us to support that level. But there are times when it's just more appropriate for people to do things in small groups, and we are able to provide that. Training is based on the hour rather than on a whole schedule, and it should still be based on a very specific assessment or person-centered assessment, since it is going to be skill-based. The regulations have stated, for as long as I've known them, that ILS can be provided at home, in the person's own home or their family home, or in the community. It used to be, at least with San Andreas, that they would only approve ILS if it seemed imminent that a person would be living in the community within a year or two. We've recently gotten communication that is more accepting of ILS in the parent's family home, so helping them either getting, I just told you it wasn't a readiness model, but developing some skills where they'll be more comfortable living in their own home, or learning how to take public transportation, some of those kinds of things. So if you have a son or daughter living with you, they can receive ILS while they're still in your home. IS eligibility, they must be finished with their school program. Regional centers think of ILS services when a person is still in school as being kind of double dipping or a duplication of services. And even though a lot of times schools don't provide assistance to help people really getting out in the community and being more independent, it's still considered a generic task, or one that the schools should complete. So regional centers, I've never known them to provide this to anyone that's still in a school program, but I'm sure there's times where they might. The minimum age for ILS is 18, although for many people they're not completing their school programs or graduating from school until they're 21 or 22, so the minimum age may be older than that. And of course, a person must have a developmental disability to receive regional center, and regional center funding is part of the ILS eligibility. So that completes my presentation. If anyone has any questions, I know Helen will help get those to me, and I'd be happy to answer anything that comes to mind. I've also included my email address. Please feel free, if you have additional questions, to email me, and I'll be happy to respond. Thanks so much.
Great. Ellen, do we have any questions? Oh, and Ellen is probably on mute.
Can you hear me now?
Yes.
Yep.
Okay. Don't know what happened. All right. So I have one question so far. I have a son with schizophrenia, and I'm interested in finding either SLS or a semi-independent living situation. Do you have any resources or info for this group or individuals?
Well, we do serve people with a dual diagnosis. So if your son or daughter has a mental health diagnosis and a developmental disability, then they certainly will be eligible for supported living. I don't know where you live in Santa Clara County. There's an organization called Momentum who serves people with mental health diagnoses, and they do have some independent living, and I don't know if they own the apartments or they help people with apartment living. So Momentum is an organization I would get in touch with if you're in Santa Clara Valley, and the person does not have a dual diagnosis with developmental disability.
And let me just mention something as we're talking about this. One thing, because I've been spending a lot of time talking to a number of SLS agencies, including Hope Services. And by the way, Hope Services does a fantastic job and is an icon in the South Bay area. So one of the things, Lyndon, you can correct me if I'm wrong here, is that you know, part of running a program like that is really keeping track of all sorts of different services in the communities, and that's, you know, I mean, part of it is that you have to learn those resources and to be able to fill in all the gaps.
Absolutely. In fact, the regional center, with all services, sees themselves as kind of the service of last resort. And all that means is that they will only fund after what we call generic services, which are services for everyone, have been researched and secured. So even with supported living, we're required through San Andreas for all of our clients to be evaluated and funding through in-home support services. That's part of the Department of Social Services. So we have to build our funding around that and build our staffing around their regulations and all. But then, yeah, you're right. There's a whole array. We deal a lot. Well, we do a lot of research, to be honest with you, a lot in helping people access other services in the community. It could be folks that are going to healthcare clinics, which is typical, but also we have a lot of folks that go to food banks, they go to the Y, they go to activities that local parks and recreation departments provide. You know, there's a whole array of resources. Again, Stephen, if you're interested, that's something I could provide you for your website, give people ideas about other services and resources that are not, a lot of them are free, but that the regional center doesn't pay for until we've exhausted all of those generic resources.
And then let me just go one step further, because one of the projects that we've been involved with, and our expectation is that Hope Services will participate, and we'll be finding out soon, is that we've been working on this life passage planning project where for folks that are not regional center clients or are not getting SLS services, part of what this will do is open it up to be able to pay privately for these services. The unfortunate thing in California, and I think this is an ongoing problem, is that for folks that are not regional center clients, so for instance, if your loved one is really has strictly a mental health diagnosis, a lot of these wonderful services with the regional center are just plain not available. And our hope is, by tapping into the services that these agencies provide, we'll be able to provide that privately for folks. I would tell you, we have many beneficiaries that are on SLS services where we either help provide them a home to live in, or we pay for their rent and that kind of thing. And the services that these SLS agencies provide are pretty incredible and really help a great deal.
And I think, you know, you and I, Stephen, have talked about all of those aspects, even of supported living. If the person is a regional center client and the regional center pays for the staffing and that type of thing, there's still so many expenses that we all have in living that working with your organization or with Passages will be great, because how do people get clothes? How do they go on vacations? How do they pay additional medical expenses at Medicare? We all know that we're just kind of waiting for the Medicaid and Medicare bubble to burst somewhat, and we don't know what that funding will be like. So this is going to be amazing for people that have money that they can access for all of those things the regional center can't or won't pay for.
So
I just have one more question. It's just somebody's asking if the PowerPoint presentation will be available. So can you make that available to me, Linda?
Absolutely.
Okay.
Happy to.
And then
You can tell me
just to
later
emphasize,
how to do that. I guess to send it to you as an attachment.
Yeah.
if you send it to her, she'll make sure it works. Now, just to go through this, what we're focusing on right now is this specific agency and the different counties that Hope Services provides. But basically, for regional center clients, SLS and ILS services should be available anywhere in the state. Of course, they're going to be run very differently depending on the agency. Is that pretty much correct?
That's really correct. but I will tell you that my experience is in California is so different. You guys are really lucky to be in this state, regardless of the differences between agencies. A little side job that I have is I accredit social service agencies throughout Canada and the U.S., and I haven't seen supported living provided in any other areas the way it is in California. It's pretty. I think it's a pretty spectacular service. And even though different agencies have different ways, I think those principles and values that we talked about are kind of the cornerstone of most organizations.
And especially for those of you that are family members that are trying to, I would say both as a trustee but also as a special needs practitioner, having an appropriate living situation for most of the folks we serve is like the number one issue. And a lot of times people just focus on, well, will there be a place for my child to live? But this goes a lot beyond that, because this really does provide those supports that will add that extra quality of life. So for those of you that are looking at this as an option, you certainly want to get to know your SLS agencies in your community. So
yeah, I agree with you. Yeah, I just kind of felt. Oops. Is that me?
Well, you're cutting out, but try it again.
Okay. What I was going to say is, I think too the important thing I would guess for families is the extent that they can be involved. Now, we all know that there's some folks that we serve that don't want their families involved, and we do our best to keep people connected. But I would say well over 95% of the people we serve are close to their families, so their families really have a say. And the important thing, too, is that the way that supported living is structured and funded, it can be for as long as the person needs that support, which for most of the people we serve, if not all of them right now, they're going to need that service the rest of their life. And I think that can be reassuring to a family. And also knowing that if it's not going well, they can change agencies. I'm sorry I cut you off there.
Oh, no, that's a very good point. Well, here's the question I was going to answer, and I think I know the answer, but I'm going to ask it anyway. What if this is mostly for individuals that are living in their own home. What if they're living in they're adults and they're living in their parents' home? Is this available?
To be honest with you, I've not seen the regional center agree with that. It's such an important part of the regs that they're in their own home where they have control. There have been a couple situations, one with Hope that I know of, where a family has been elderly and they are concerned that they won't be around for much longer, and I've seen the regional center be willing, if the person has, can make choices about their life and they have privacy in the home, that I've seen the regional center fund it. But they're really picky about that, and where people have lived, like the gentleman Alex that I talked about. So the way that his situation works is the way the building codes are. You have to start with a common wall, but there doesn't have to be a connection between the two homes. There can be private entrances and exits. So we did have to make sure that in this case, the regional center wanted there to be a separate address, and they wanted to be sure that Alex actually had a rental agreement. So even though he was living in a home that his parents owned, I don't know, we might have told the regional center he was paying some rent. I can't remember, but he's not. But the fact that, he had that private space and he had the rental agreement and a separate address, they weren't concerned that it was connected to the parents' home. So I think there's maybe ways you can work it, but that's kind of a tough one. I've also seen things where people have apartments in like the lower level of their home. And we're working with a gentleman now where the family is hoping to add a second floor onto their home, but there will be a private entry, and the regional center is willing to look at that as his own home. So I think there's kind of some ways around it, but I think if the individual is just simply living as part of the family in the family home, you'd have to look at maybe some alternatives like ILS, or I don't know, we'd have to creatively think of some other kind of service. And maybe other regional centers have a different way of defining it. I don't know.
Well, and of course, every regional center is different by design. So, but this is certainly something that one would want to explore.
I agree.
So, I think I learned a lot more about SLS and ILS services, and you know, once again, I want to thank you for sharing your information with us, and also I know the fabulous job that Hope Services does, and their stellar reputation, and so this really does add a very person-centered approach to independent living here, and so there's so many options beyond group homes and that sort of thing, and in the right situation, this can give a level of independence that I think is very unique to California. And the last thing that we need to remind ourselves is that we must always advocate for continuation of funding for these services through the Lanterman Act. And I know a lot of us get a little bit of advocacy fatigue, but were it not for the support of the community, families, consumers, and advocates, believe me, from time to time, the state is constantly looking at either limiting or eliminating these kind of services, and this is so essential to meet the promise of community living from deinstitutionalization and focus on more than just keeping a roof over somebody's head, but really more focus on quality of life. Linda, I'm going to give you the last word, and then we're going to call it a day.
Okay. I just want to thank you, and thank you, Stephen, for saying such nice things about Hope. The thing is, and this is just sort of maybe an aside, but for me it's been an interesting journey, because 20 years ago when supported living came about, people thought we were all a little crazy. Providers were like crazy because it became almost a civil rights movement for people to be able to have their own home. And I don't want to ever see supported living become just some other kind of service. You know, I think it is really special. I want to say one thing about one of your comments, Stephen, in that it's important for families to know that it's not really independent living, in that I think there's always a concern. When I talk sometimes to families about supported living, their comment is, oh my goodness, my son or daughter can't live alone. I want to really stress the fact that there is a level of support that is designed specifically to the person's needs. Currently, we may only have 1 or 2 people that don't have roommates. All of our clients have overnight staff, which not only provide the additional support they need, but provide assistance in sharing rent and some of those expenses. And so I just really, want to stress that we do provide the services that people need, and they're not alone and isolated in the community. And I think that's an important thing to hang on to, and something that isn't easily recognizable at first when people hear about this service.
Fantastic. Well, anyway, I want to thank you so much tonight. We'll make, or this afternoon here. Ellen will make sure that the folks that are listening here get a copy of the PowerPoint. And I think we all learned quite a bit, and this is a wonderful option here. Thank you very much, and that is it.
Anytime.
Goodbye.
All righty. Thank you, everybody.